Ladies and gentlemen, we have several panels across the day, and they're going to include experts from the school, health and sports settings, so we can give you a real snapshot of the three sectors. So first today, it's such a pleasure to welcome to the stage one of the ladies who was just mentioned by Denise. Can I please welcome Deanne Wooden, Senior Project Officer, Queensland Association of School Tuckshops, Brooke Maund, Senior Dietitian for a Better Choice Strategy, Statewide Foodservices, and also to Dawn Amit, Senior Community Development Officer, Good Sports Program, Alcohol and Drug Foundation. Please welcome them to the stage. High stage, high chairs, ladies. Thank you so much for joining us today and really kicking off these conversations. I'd love each of you, if you could please, just to introduce yourselves and tell us about your roles. I'll start at the end.
Is this working? Yep.
Yeah.
Hi, Deanne Wooden. I'm the Senior Projects Manager at the Queensland Association of School Tuckshops. So obviously we work in schools and in tuckshops.
So I'm Brooke Maund. I'm dietitian who sits within Statewide Foodservices with Denise, and I was one of the original project officers with ABC, but now I sit in the sort of coordinating position for ABC, supporting all of the health services across Queensland and implementing a better choice.
Hi, I'm Dawn Amit. I'm a Senior Community Development Officer at the Alcohol and Drug Foundation. And I'm here because I worked on the healthy eating program funded by Queensland Health for a number of years.
So we have three ladies here who we want to make this a conversation with all of you as well. So please feel free to pop your hands in the air. And also if you're joining us online, we've got the questions here ready to go. So please feel free to jump in. Ladies, I imagine there are some common themes, what we're all looking for and what we want to do. But for each of you in your space, what is the most important thing to you right now?
Well, in the school space, working with tuckshop conveners who run the school tuckshops, one of the key defining success factors for a healthy tuckshop is support from the whole school community. So, you know, that whole of school approach to healthy eating in the tuckshop, supported by the school principal, supported by the P&C, that is usually the employing organisation for the tuckshop conveners. Having that support across the whole school community, getting the parents on board with a healthy tuckshop, I think is probably the most important factor for getting a successful healthy school tuckshop menu. And of course, cost services as well.
I guess in what Anna said as well is you're embedding that change because principles change, tuckshop conveners change, so getting that change to remain.
Absolutely, yeah. With tuckshop conveners, they do a very complex role, and that's not well recognised in our community, unfortunately. And they they have a lot of barriers, and you know they're retail managers in a very high pressure environment. If you talk to a retail manager working in any cafe or coffee shop, they wouldn't have the compressed service demand that school tuckshops have. They have 20 minutes to get out, sometimes thousands, maybe not thousands, in some of the high schools potentially, but hundreds of meals to kids that are really demanding and fussy, and they just want to get their food and eat it and go out and play. So they have to deal with the children, they have to deal with the parents, they have to deal with the staff in the school. So, tuckshop conveners are very clever and really competent professionals in their roles, and, being able to support them as an organisation such as ours is, one of our sort of, I guess, key roles, and helping them to implement the policy that they need to implement by the Department of Education's the Smart Choices policy, enabling them to do that but still being able to make some profit for their P&C to then invest back in the school. It's a very complex task.
It is a fine line, isn't it? Because there's so many people you have to keep happy.
That's
right. One of the main strategies we use with sports clubs is strengthening their volunteers, and I guess encouraging their volunteers to kind of not bond, but kind of get to know each other, to break down their barriers, kind of not feeling as if you fit in as a parent in the canteen or in the school tuck shop could be a barrier to helping out and being I guess making that change, and also a barrier to actually voicing your opinion on what they're serving. So if you have a kind of good parents, good volunteers that are confident to help out and speak out, I suppose, if somebody's serving something that you may not want your children to eat. So one of the goals at the Alcohol and Drug Foundation is to strengthen community, strengthen volunteers. Yeah.
So what's important to me, I guess, is working in healthcare, we are seen, or should be seen as the leaders in creating healthy food environments. So Denise has already talked to this morning, but in A Better Choice in Healthcare, we do have the Mandatory Health Service Directive. So we have to have a certain percentage of green, amber and red foods in all of our health services. But implementing that is incredibly challenging work, because me sitting at a centralised position at Statewide Foodservices, I'm supporting all the health services and saying we need to do this, but then we don't actually have the green and amber foods available to us to support these changes. So I guess what's really important to me is actually working together with industry, and not blindly, like Rob said, not just, not just promoting products, but actually working with suppliers and manufacturers to present the A Better Choice strategy, say these are the criteria that we've got, how can we work together to create healthier options that actually makes my job easier, because it means that I can then work with health services to implement these products. What's really important to me, I guess, is the partnerships and working with industry with our strategy behind it to say, this is what we can do together.
I guess it's hard sometimes, isn't it, as well, to make a blanket approach for sporting clubs and for schools particularly, because you'll have schools of incredibly different sizes, clubs with different resources that are quite well off or wealthy. So it is hard to sort of one size fits all.
100%. Because in healthcare, so we've got 17 health services, including the MARTA, across Queensland, and we all know how big Queensland is and how diverse our population is. So every health service is completely different, and how you implement ABC in health services, you're completely right. There's no one size fits all. And even in terms of how that work is done, in terms of whether it's a retail manager that's making the changes, or whether it's a cafe shop owner, or or dietitian or whoever, that it's a different approach everywhere.
And Deanne, is it sometimes schools not knowing what they need or what they can do?
Oh, absolutely. Quest is a membership association, so we have up to 500 members, but there are around 1,650 schools in Queensland with Tuckshops. So, we're not reaching everybody with our messaging. We're trying really hard, but we've got lots of tools and resources, which, as Anna pointed out, is one of the most important things, is to have those tools and resources for the people on the ground that are implementing. But, we're limited by how much we can, what reach we have out in the communities that we serve. We often hear that people who work in school tuckshops don't even know that we exist as an organisation and don't know where to go to get help. So, not knowing where to go to get help is sometimes a big barrier.
And Dawn, for clubs, they're not just worrying about food. In this case, it's food, but clubs are worrying about sport and playing and other things as well. So it's not always their sole focus.
No, they're So that's definitely right. A lot of the parents that volunteer at clubs are kind of time poor. They may not know about nutrition. The convener may be stuck in their old habits. There are different canteens with different resources. Some of the clubs that we've worked with that have done really well changing their menus, I suppose, have had really good volunteers that have been, been established at the club for a long time, and they've been partners with, other families to work in the canteen and produce some really good healthy foods. But obviously it's kind of a clique sometimes, so that could be a barrier to other people helping. And smaller canteens have done well by serving. One of the tricks a lady said to me that she used to do in Mount Isa was so she had a small canteen, and she really didn't want to sell pies and kind of that sort of food. So she would serve one pie, have it in the pie warmer, And when that would sell out, she would then just sell sandwiches. But she said, if I don't serve the pie, people will be angry. So I say, oh, I'm sorry, that's just sold out. So here are some sandwiches. But since you're here, here's a sandwich, a better option. So it's tricks for all the clubs, different things that people do.
Love tricks, love tricks. That's a great example of something that's working for you. What about for you, Brooke? What are some of the things that are being successful for you?
I think what is working well is having a centralised position to support ABC within Queensland Health, because Health and Wellbeing Queensland, since they've taken on ABC on board, obviously we've got a huge increase in awareness, and which is really exciting. But if the strategy has to match the challenges that happen at a health service level, so I think what's working well is having the position, my position within Queensland Health, to talk with Sheridan, wherever she is, at Health and Wellbeing Queensland. Where is she? Yes. Because I couldn't do this without Sheridan. But there has to be that link between the strategy and the practical strategy, the policy and the strategy behind the scenes, and the practical implementation challenges that health services see every day. What's working well is having that connection, a centralised position to facilitate Health and Wellbeing Queensland with the health services and also with food industry to facilitate the connections between all of them.
Deanne, can you give us an insight to yours?
So what's working really well is, I mentioned the challenges of communicating across all schools in Queensland, but we have funding from Health and Wellbeing Queensland to deliver the Healthier Tuckshop Support Program, which is basically a communications program, and through that funding we're able to hopefully reach more than just our member base, so that is definitely working really well. Having the Smart Choices policy sort of underpinning what we do in terms of promoting the healthier food and drink options, and then, as I mentioned, having some really, really motivated tuckshop conveners that are, totally on board with the healthier options in school tuckshops, and, gathering all of the information and the successes that they do, provide in their own tuckshops, and being able to showcase those as case studies in our messaging out to all tuckshops in Queensland is definitely a key driver as well.
And for you, Dawn, any other successes you'd like to share?
Good volunteers.
And we'll be talking about that across the day as well. So if I were to hand you a magic wand in Robin's perfect world, if you could look ahead, what would be the challenges that you've overcome? If you could say, yep, we've done it, what would that be?
I think, having healthy food as a priority in all schools in Queensland and even all schools in Australia is definitely, and that whole of school approach. At the moment, I think Smart Choices is perceived to be a tuckshop only policy, and we know, if you care to read the strategy, that it is supposed to be covering all food that is provided in the school environment, but unfortunately it's often sort of handed over to the tuckshop convener to say, here, this is your strategy. We know that tuckshops are getting busier, and we don't actually have the numbers in Queensland, but we know from New South Wales data, if we extrapolate that to the Queensland population, we've got about probably 75 to 80,000 Queensland students accessing a tuckshop 3 to 5 days a week. So it is actually really important to make sure that there's healthier options available. And what we're hearing from our members is that tuckshops are getting busier. So, overcoming the challenge of the perception that a tuckshop is just a treat. It's not. It's an essential service for busy families. It's getting busier. And we need to make sure that those healthier options are always available. And to do that, we need to have the whole school on board.
I guess it's that chicken egg thing, isn't it? If you know it's healthier, you might choose it more for your children.
Yeah, and parent engagement is really important for that. We think back to when we went to school and our experience of tuckshop, it was probably much more of a treat perception back then, but these days it's not a treat anymore. There are families that rely on the tuckshop, cost of living pressures. We've got 2 parents working, and even though you think cost of living, you wouldn't be buying food outside of the house, we know that tuckshop foods are affordable, and that's actually built on a base of volunteers, which is increasingly difficult to get as well. So, but I digress. Tuckshops are really important in the school community, and success would be that the whole of school, including the parents, are engaged with a healthier tuckshop, and we've got healthy food going into the kids.
Similarly, I would like to change perceptions as well. So one of the biggest challenges that I see in my role, when I'm working with retailers and vendors, talking about putting healthier foods in our retail outlets and in our vending machines, one of the barriers that is mentioned is, people when they're in hospital, when they're in a stressful situation, they want to be able to go to whatever store or vending machine or whatever. They need their chips and chocolate and soft drink. In those stressful situations, those are the foods that they're reaching for. And I guess I'd really like to change that perception that we need those discretionary foods in those environments. I think if we have healthier food available, these are the options that people would rather, reach for. I mean, Denise has already spoken this morning about the link between healthy eating and mental health. So we know that in these times of stress, we need to be nourishing our bodies. So why not fill our retail outlets with, healthier options and vending machines as well, so that in those stressful situations, people have the option of choosing the healthier food. And I would just love to change that perception that when you're in that stressful situation, you don't necessarily need those discretionary foods. They're not the ones that are best for us. So.
Deanne, just a question that's come in online for you. How do we convince those kids they don't want those sweeter drinks?
You don't have them available. The school tuck shop is not a convenience store. It's an essential service for busy families, and kids don't need to be drinking sugary drinks when they're at school, full stop.
And Dawn, your magic wand, what would you have overcome?
One of the barriers that we hear about when speaking to sporting clubs is that they don't want to lose revenue in the shop. So I suppose my magic wand would be, and this is as a volunteer that has also volunteered at my children's sporting club, that I have sometimes served the bacon and bread to parents and apologised for the bacon and bread or sausage, and have refused to buy it myself because I won't buy it for my young family. So I suppose the barrier is sometimes not really there. It's the consumer is there, willing to spend money on good quality food for their families, and I think that's something that clubs need to kind of realise. Yeah.
Another that's come in from online, and I think it really could apply to all of you. Anna spoke earlier about the strategic positioning, not on the shelf, where it goes on the shelf, and we know that that's what retailers do it as well. How do you overcome that challenge of profits versus healthier eating? I'm sure it's the most asked question.
Well, I think Anna would probably be a fantastic person to talk to that too, because they have some incredible research coming out of Victoria that shows that you don't lose profits. They have... it was a webinar that was just happened a couple of weeks ago, and there was a retailer there who had completely changed all of their health service to 100% green, and they hadn't lost profit. So there's this perception that when you put healthier products on the shelf, you're going to lose money. That's it. I mean, I understand it. I understand that retailers have just come through COVID, so they've lost a lot of revenue from not having, visitors in their. They haven't had the people to buy the food, but a growing amount of research is actually showing us that you don't necessarily have to lose profits by putting healthier options. Yep.
So just another plug for Quast. We do a service called the Financial Advisory Service, where we go through the financials of a school tuck shop profit and loss and look at the cost of ingredients, and also look at the labour that it takes to make those food products. And we've done a number of projects with many, many different tuck shops across Queensland, looking at changes to the menu, healthier changes to the menu, and we can see improvements in their bottom line in terms of revenue. So, our key messaging around revenue or profit in school tuck shops is, if you make the food from scratch, then you have much higher profit margin, and we've got costing spreadsheets and calculators to prove that. The biggest barrier to that is people expect tuck shop foods to be cheap, and also the model that tuck shops are built on is that volunteer model, and it's increasingly difficult to get volunteers. So stay tuned. We're about to release a course on volunteer recruitment and management as well to try and overcome that barrier. But, you know, we've got lots of examples of where changing menus to have more green and no red and less amber actually ends up with a profit for the tuck shop. But it is a very complex task. There's an algorithm behind it. But, you know, there's lots of tuck shop conveners representatives here today if you want to know more about it. There'll be some speakers on the panels later.
Have I got time to jump in again? Another thing that I just wanted to mention, from a local context, I met with the Darling Downs. So Deb Matthews, the manager of the Wellbeing Cafe in Townsville, Toowoomba, has done an incredible job at making healthy happen. And that was one of the things that we talked about. We did a case study with them to ask what changes that they'd made. And one of the biggest things there, sort of successes, I guess, is Deb's can-do attitude, and just deciding, okay, in Queensland Health, we've got a mandatory health service director, we have to do it. How can we do it? What changes can we make? And they did it without losing a profit, I think. It was challenging, but I think having that can-do attitude can really help with making it all happen.
And I guess the extension of that, Deanne, we've had another one for you from online, just asking us about how you got that whole school strategy, how you got them on board.
Well, it's really up to the individual school in that sense. And, you know, where we've just released a case study for a school up in Cannonvale, which is near Early Beach, and they have support of the principal, they have support of the P&C, they've used external partners, so they've been part of the Health and Wellbeing Queensland Pick of the Crop program, they've been part of the Life Education Healthy Eats program, they've used our services, and they've really just transformed the tuck shop, but also the whole school approach. So, you know, you need support from, and the parents. I mean, there has been some resistance to removing some of the unhealthy products from the tuck shop menu, but because they've got support across all elements of the school, then they're much more able to make those changes so quickly and suddenly. And we'll be recording a podcast very soon on that school, so stay tuned for that one as well.
Do I have any questions from our room before we do? Thank you.
Thank you. Hi, Alana. Hi, Deanne. I'm a nutritionist with the Root Cause, so we come into schools and do whole of school education programs from nutrition. My question is for you, Deanne, firstly. Obviously, and you're aware of this, tuck shops are under pressure from the parents, and the biggest issue that I have when I'm talking to the tuck shops is they want to make changes, they're struggling, parents kick back. A large percentage of their sales is on a Friday and it is a treat food. But what we know as parents and as consumers, that frequently the parents are allowing the children to have their treat tuck shop purchase on Fridays, but then there's also the treat purchase after school on Friday afternoons and Friday evenings. How do we support this and educate this in the tuck shop? Do you meet with the principals to have discussions around this as well? How does this get communicated across the school to make this change that we know as a collective group needs to change?
Well, I would say that's up to the P&C of the school, because tuck shops generally are run by the P&C and conveners are employed by the P&C, and the P&C is the parent representative body. So if the P&C is on board with a healthier tuck shop menu and there's any complaints about that, then the parents that have an issue with that need to go to the P&C meeting. Wouldn't that be great if parents actually went to those meetings and have their say, and then they can have that conversation. But also remembering that, you know, the Smart Choices policy is a mandatory policy, so there is a requirement that the tuck shop does implement that policy. But messaging out to the school community and making sure, you know, asking the principal to be on board with those healthy changes, and then directing any complaints about, you know, tuck shop choices to the principal is probably the best port of call, I would say.
Cool, thank you. And my next question is about sports environments. So when I present at schools, the greatest hurrah that comes from the children is whenever I pull out a sports drink, and this has incredible power over our children, and our parents have this incredible belief that children that are participating in after-school activities and on Saturday sports need to have sport drinks. What's your position? And you know, we know how much sugar that many of them contain, and many of them have significant food colourings that may have adverse effects on children as well. What's your position in terms of advising this into sports communities?
In the healthy eating program, we would talk to the canteen conveners and ask them to reduce. I haven't worked on it for a couple of years, but there were 5 flavours at some point. I don't know if there are more now. So we would ask them to kind of reduce to 1 flavour or 2 flavours, and then take a few months and then try and remove them off the shelf and put them under the counter and only have them if people, you know, deliberately ask for them, and then after 6 months or so kind of remove them all. So just have that slow transition. Not to remove everything at once, otherwise you get into a bit of a upset parents and upset children, but just reduce the numbers down so there are less flavours available, and then get rid of them altogether.
Thank you.
Thanks, Alana. Well, ladies, thank you very much. That is time for us to wrap up. If you need to send through any other questions, you're more than welcome to. Would you please put your hands together and thank our 3 speakers?